If you, or maybe someone you know, has ever suddenly doubled over with totally unexplained agonizing abdominal pain right after a heavy meal, well, you know exactly how terrifying it can be. Welcome to this explainer. Today, we're taking the mystery out of gallbladder disease. We're going to walk through the exact mechanics of what goes wrong, how doctors figure it out, and the seriously fascinating surgical innovations they use to fix it. Here is our roadmap for today. First, we'll meet your gallbladder, uncover exactly why gallstones form, and look at how the problem is diagnosed. Then, we'll compare the different surgical solutions, talk about diet and recovery, and finally, dive into post-cholecystectomy syndrome. All right, let's start with the basics. Section 1, meet your gallbladder, anatomy and function. So picture a small pear-shaped organ tucked right up underneath your liver, over on the right side of your abdomen. Think of it as a pretty simple storage tank for your body's plumbing system. You see, your liver is constantly producing this fluid called bile, which you absolutely need to break down the fats you eat. But instead of that bile constantly dripping into your digestive tract all day, it gets stored up in the gallbladder. Then, when you sit down and eat a big fatty meal, the gallbladder squeezes and shoots that stored bile straight into your intestines to help out with digestion. Now, when we talk about gallbladder issues, you're going to hear two massive, kind of intimidating medical terms. The first is cholelithiasis. That literally just means having gallstones. These little hardened lumps made mostly of cholesterol or bilirubin. Honestly, a lot of people have these and literally never even know it. But the real trouble starts with the second term, cholecystitis. This is the severe inflammation that kicks in when one of those stones gets stuck in a duct and totally blocks the flow of bile. So the stones are the physical blockage, and the inflammation is the incredibly painful, sometimes really dangerous consequence of that blockage. So who actually gets these stones and why? Let's get into section 2, why gallstones form, uncovering the triggers. Understanding the risk factors here is absolutely crucial. In the medical world, they mirror a classic memory tool often called the 4Fs. It's not perfectly accurate for everyone, but it's a great way to remember the primary risks: female, 40 or older, fat or dealing with obesity, and family history. Women are historically at a much higher risk, especially if they have increased estrogen from pregnancy or hormone therapy, because that actually increases cholesterol secretion right into the bile. Older adults naturally have a higher risk too, and carrying extra weight or eating a high-calorie diet leads to what's called cholesterol supersaturation. But here's the surprising one. Rapid weight loss, like what happens after bariatric surgery, also drastically spikes your risk, because dropping weight that fast impairs your gallbladder's ability to empty properly. When one of those stones finally decides to block a duct, trust me, your body hits the alarm immediately. The classic symptom is known as biliary colic. This is an acute, incredibly sharp ache right under your right ribcage. And what's wild about this is how our nerves are wired. This pain often radiates straight through to your back, right between your shoulder blades, or even shoots all the way up to your right shoulder. It usually hits hard, fast, and very often right after you've eaten a heavy, greasy meal, because that's when your gallbladder is aggressively trying to squeeze bile past the blockage. So you're having an attack, and you go to the doctor. What happens next? Section 3, diagnosing the problem, finding the stones. Your doctor is going to guide you through a very specific diagnostic journey. First up, they'll do a physical exam and check for something called Murphy's sign. The doctor will actually press their hand just below your right ribcage and ask you to take a deep breath in. When you inhale, your gallbladder naturally moves down. If it bumps into their hand and you suddenly gasp or catch your breath because of the sharp pain, well, that's a positive Murphy sign, a huge red flag for an inflamed gallbladder. Next, they'll draw some blood to check your liver enzymes and look for inflammation markers. And finally, the big one, an ultrasound. You might be wondering, hey, why not order a fancy CT scan? Well, actually, scratch that. Standard CT scans can miss cholesterol gallstones in up to 40% of cases. An ultrasound is literally the gold standard here. It's cost-effective, non-invasive, and it beautifully highlights those stones and any dangerous thickening of the gallbladder wall. Once the diagnosis is confirmed, what's next? Section 4, comparing surgical solutions, the path to relief. If you've got symptomatic gallstones, the most definitive fix is taking the faulty organ out entirely. And the way we do this has changed completely. There is a literal night and day difference between historical surgery and modern medicine. In a traditional open surgery, the surgeon has to make a massive 5 to 7 inch cut right across your belly. That means a 3 to 5 day hospital stay and well over a month of agonizing recovery. But today, laparoscopic surgery is the standard. Surgeons make 3 or 4 tiny centimeter-long cuts, use a camera to gently remove the organ, and a lot of times you go home the exact same day. The pain is drastically reduced, and you are usually back to your normal life in just a week or two. It's a total game changer. Now, today, there's also a third highly futuristic option available: robotic cholecystectomy. This is where the surgeon sits at a console across the room and controls robotic arms to do the surgery. The pros are just unbelievable. The surgeon gets a gorgeous 3D, high-definition view inside your body, and those robotic wrists offer a level of dexterity and precision that human hands simply cannot match, which means even less blood loss. But, and it's a big but, there are real cons. The biggest drawback is a total lack of tactile feedback. The surgeon can't actually feel the tension of the tissue they're pulling on, so there's a steep learning curve to rely purely on visual cues. Plus, these robots are incredibly expensive and take way longer to set up in the operating room. All right, so the surgery is done and the gallbladder is gone. Section 5, Diet and Recovery, the new normal. So your body's plumbing has totally, permanently changed. Remember that storage tank we talked about earlier? It's gone. Now bile just drips continuously from your liver directly into your intestines. So think about it. If you suddenly eat a massive plate of greasy fried chicken right after surgery, there is no reserve tank of bile ready to squeeze out and handle all that fat at once. Your system gets completely overwhelmed, which, as you can probably guess, leads to some serious indigestion and diarrhea. You've got to give your body some major help in those early days by strictly limiting high-fat, greasy, and fried foods. You essentially need to train your digestive system for its new normal. You want to eat small, frequent meals throughout the day. That way, the constant slow drip of bile is enough to handle the smaller amounts of food you're digesting. Keep those fats super low at first and slowly reintroduce dietary fiber over a few weeks to help bulk up your digestion naturally. And of course, stay hydrated. For most people, within a month or so, their body completely adapts and they can go right back to eating a normal, healthy diet without any issues at all. Okay, let's look at one last thing. A condition you should absolutely be aware of, but definitely shouldn't fear. Section 6. Post-cholecystectomy syndrome. Imagine this scenario. A patient gets their gallbladder removed, goes through the whole recovery process, everything seems fine, but then months or even years later, they start experiencing that exact same sharp pain in the right side all over again. Or maybe they develop severe nausea and chronic heartburn out of nowhere. This is called post-cholecystectomy syndrome, or PCS. It essentially means you're having persistent gallbladder-like symptoms, even though the gallbladder itself is long gone. Why does this happen? Usually, it's because a tiny stone was left behind in the common bile duct, or maybe a stricture, like a narrowing, has formed in the plumbing over time. If this happens to you, the #1 rule is do not panic. Doctors are incredibly good at identifying the root cause here. They'll almost always start with another quick abdominal ultrasound to look for any of those sneaky retained stones or widened ducts. They might order a CT scan just to make sure your pancreas isn't getting inflamed. But the absolute ultimate tool for this is a procedure called an ERCP. A specialized tube is carefully guided down your throat, past your stomach, right to the opening of the bile ducts. It's literally amazing because not only does it perfectly diagnose the exact blockage, but the doctor can actually remove the retained stone right then and there during the test, instantly getting you back on the road to full health. And that brings us to the end of our journey today. We've gone from understanding the basic plumbing to identifying the agonizing signs of a blockage, comparing the modern miracles of surgical robotics, and successfully navigating the new normal of recovery. I want to leave you with this provocative thought. Your gallbladder may be gone, but is your body still trying to tell you something? Because even without this little pear-shaped organ, your digestive tract remains an incredibly complex, delicate system. Always listen to those signals, be mindful of what you're eating, and never ever hesitate to follow up with a doctor if something just doesn't feel right. Thank you so much for joining me on this explainer. Keep learning, keep listening to your body, and I'll catch you on the next one.